To find out more about NHS CHC in Greenwich, email or phone the CHC team at Greenwich Clinical Commissioning Group. Email is greccc.continuingcare@nhs.net. Phone number is 020 3049 9000. Here are some members of the CHC team talking about what they do.
I'm the Continuing Healthcare Manager for Greenwich CCG. My job entails managing a team of nurses for continuing healthcare assessment, as well as managing a care home support team, and also we have done an innovative project in the hospital that I lead on.
I'm a continuing care nurse from Greenwich NHS Clinical Commissioning Group. What I find very special about my job is I think it's a privilege to work with families and individuals, to know that I've made a difference to their lives, in that wherever possible supporting them to remain at home with the care that they need, and to provide really personalised individual care to them.
I'm the Deputy Nurse Manager of the Continuing Healthcare team, so I manage a team of nurses. I also lead on personal health budgets for people who are eligible for continuing healthcare. I'm a learning disability nurse by profession, so I ensure that people with learning disabilities are included in the assessments for continuing healthcare. But as part of that, I, across the board for everybody else, ensure that their assessments are personalised and person-centred.
The unique thing about my job is giving individualized care and personalizing my patients' care to promote their health and well-being, and making sure that these patients live feeling empowered and feeling that they are in charge of their care and making them happy.
My job is unique because I do continuing healthcare assessment. I work across health and social, and I do have an autonomy to put in complex care packages to fulfill my clients' wishes of remaining at home.
My job entails a lot of liaising with the hospitals and referral discharge teams, some care providers, and sending letters to the families and friends of the patients. The benefits of my client is there's no delay in the outcome of their care package, so I make sure information is accurate and up to date.
What's unique about my job is that I'm able to provide advice and support to a multitude of professionals, including social workers and nurses, in the hope that quality assessments are completed with consistency and that the outcomes for individuals are the right ones.
Like the other nurses on the team, I also assess people for continuing healthcare and create care packages in the community. However, I've also got an extra interest in the transition process from children's to adult services. We are hoping to create a much smoother pathway for young people from children's services to adult services, and as well for the families that support them.
I work very closely with the clients, the families, and the care providers. I act as an advocate whilst carrying out my assessment to ensure that the care needs are being provided adequately and any gaps in the care are being fed back to the care providers, ensuring that the quality of care is high standards, ensuring that the care providers are following regulations as set up by CQC standards, basically making sure that they have the best quality and dignity.
Well, I hope you found that useful. If you would like to discuss continuing healthcare or anything else with the Greenwich Continuing Healthcare team, please contact us at our telephone number on 020 3049 9000 or at our email address greccg.continuingcare@nhs.net.